Question 1. Which patient should the nurse see first? A patient with BP 150/90 and headache. B. Patient with chest pain and sweating. C. Patient with fever of 38.5 degrees Celsius. D. Patient requesting pain medication. Correct answer, B. Patient with chest pain and sweating. Rationale: chest pain with diaphoresis suggests possible myocardial infarction. Strategy: prioritize life-threatening cardiac symptoms first, ABCs. Question 2. Which patient should the nurse assess first? A. Post-op patient with pain 7/10. B. Patient with sudden shortness of breath. C. Patient waiting for discharge. D. Patient requesting water. Correct answer, B. Patient with sudden shortness of breath. Rationale: shortness of breath indicates airway/breathing emergency. Strategy: airway and breathing always first. Question 3. Which patient requires immediate attention? A diabetic patient with blood sugar 250. B. Patient with new confusion. C. Patient with mild nausea. D. Patient with constipation. Correct answer, B. Patient with new confusion. Rationale: sudden confusion may indicate hypoxia or stroke. Strategy: acute changes beat chronic conditions. Question 4. Which patient should be seen first? A. Postpartum patient with heavy bleeding. B. Patient with mild headache. C. Patient requesting blanket. D. Patient with scheduled medication. Correct answer, A. Postpartum patient with heavy bleeding. Rationale: heavy bleeding can cause shock. Strategy: circulation issues equals priority. Question 5. Which patient should the nurse prioritize? A. Patient with potassium 3.2. B. Patient with potassium 6.5. C. Patient with sodium 130. D. A patient with calcium 8.5. Correct answer, B. Patient with potassium 6.5. Rationale: high potassium can cause cardiac arrest. Strategy: dangerous lab values first. Question 6. Which patient should the nurse see first? A. Patient with oxygen saturation 88%. B. Patient with pain 8/10. C. Patient requesting food. D. Patient sleeping. Correct answer, A. Patient with oxygen saturation 88%. Rationale: low oxygen saturation indicates hypoxia. Strategy: airway and oxygen first. Question 7. Which patient requires immediate care? A. Patient with slurred speech. B. Patient with nausea. C. Patient with mild fever. D. Patient requesting discharge. Correct answer, A. Patient with slurred speech. Rationale: stroke symptoms require immediate intervention. Strategy: neurological emergencies equals priority. Question 8. Which patient should be seen first? A. Post-op patient with restlessness. B. Patient with stable vital signs. C. Patient requesting water. D. Patient with constipation. Correct answer, A. Post-op patient with restlessness. Rationale: restlessness is early sign of hypoxia. Strategy: early warning signs first. Question 9. Which patient should the nurse assess first? A. Patient with BP 180/110. B. Patient with BP 140/90. C. Patient with headache. D. Patient with fatigue. Correct answer, A. Patient with BP 180/110. Rationale: hypertensive crisis risk. Strategy: critical vital signs first. Question 10. Which patient should be seen first? A. Patient with new chest tube bubbling. B. Patient with mild cough. C. Patient requesting pain meds. D. Patient eating. Correct answer, A. Patient with new chest tube bubbling. Rationale: could indicate air leak. Strategy: equipment malfunction equals priority. Question 11. Which patient should the nurse see first? A. Patient with difficulty swallowing. B. Patient with mild pain. C. Patient requesting TV remote. D. Patient sleeping. Correct answer: A. Difficulty swallowing. Rationale: risk of airway obstruction. Strategy: airway first. Question 12. A nurse receives 4 patients. Who first? A. Blood sugar 40 mg per deciliter. B. Blood sugar 200 mg per deciliter. C. Blood sugar 180 mg per deciliter. D. Blood sugar 150 mg per deciliter. Correct answer: A. Blood sugar 40 mg per deciliter. Rationale: hypoglycemia is life-threatening. Strategy: low kills fast. Question 13. Which patient first? A. A wheezing patient. B. Mild fever. C. Mild headache. D. Constipation. Correct answer: A. Wheezing patient. Rationale: airway compromise. Strategy: breathing priority. Question 14. Which patient first? A. Post-op bleeding. B. Pain 7 out of 10. C. Nausea. D. Anxiety. Correct answer: A. Post-op bleeding. Rationale: risk of shock. Strategy: circulation first. Question 15. Which patient first? A. Unresponsive patient. B. Sleeping patient. C. Eating patient. D. Talking patient. Correct answer: A. Unresponsive patient. Rationale: life-threatening. Strategy: unstable stable. Question 16. Which patient should the nurse see first? A. Patient with stridor. B. Patient with mild headache. C. Patient requesting food. D. Patient with constipation. Correct answer: A. Patient with stridor. Rationale: stridor indicates airway obstruction which is life-threatening. Strategy: airway always comes first, ABC rule. Question 17. Which patient should the nurse assess first? A. Patient with sudden chest pain. B. Patient with mild fever. C. Patient requesting discharge. D. Patient with nausea. Correct answer: A. Patient with sudden chest pain. Rationale: sudden chest pain may indicate myocardial infarction. Strategy: cardiac symptoms are priority. Question 18. Which patient should the nurse see first? A. Patient having seizure. B. Patient with mild pain. C. Patient requesting blanket. D. Patient with constipation. Correct answer: A. Patient having seizure. Rationale: seizure places patient at risk for injury and airway compromise. Strategy: safety and airway first. Question 19. Which patient should the nurse see first? A. Patient with cyanosis. B. Patient with mild fever. C. Patient requesting water. D. Patient with nausea. Correct answer: A. Patient with cyanosis. Rationale: cyanosis indicates severe hypoxia. Strategy: blue equals oxygen problem equals priority. Question 20. Which patient requires immediate care? A. Patient with absent pulse in leg. B. Patient with mild swelling. C. Patient requesting medication. D. Patient with headache. Correct answer: A. Patient with absent pulse in leg. Rationale: absent pulse indicates impaired circulation. Strategy: circulation problems equals priority. Question 21. Which patient should the nurse assess first? A. Respiratory rate 8 per minute. B. Respiratory rate 20 per minute. C. Respiratory rate 18 per minute. D. Respiratory rate 16 per minute. Correct answer: A. Respiratory rate 8 per minute. Rationale: low respiratory rate indicates respiratory depression. Strategy: breathing always first. Question 22. Which patient should be seen first? A. Patient with sudden vision loss. B. Patient with mild headache. C. Patient with nausea. D. Patient requesting food. Correct answer: A patient with sudden vision loss. Rationale: sudden vision loss may indicate stroke. Strategy: acute neurological change equals priority. Question 23. Which patient should the nurse assess first? A. Patient with severe abdominal pain. B. Patient with mild pain. C. Patient requesting discharge. D. Patient with constipation. Correct answer: A. Patient with severe abdominal pain. Rationale: severe abdominal pain may indicate internal bleeding. Strategy: severe symptoms first. Question 24. Which patient should the nurse see first? A. Patient choking. B. Patient with mild cough. C. Patient requesting water. D. Patient with nausea. Correct answer: A. Patient choking. Rationale: choking blocks airway. Strategy: airway emergency first. Question 25. Which patient should be seen first? A. Patient with sudden agitation. B. Patient sleeping. C. Patient requesting medication. D. Patient with constipation. Correct answer: A. Patient with sudden agitation. Rationale: agitation may indicate hypoxia. Strategy: early signs of hypoxia first. Question 26. Which patient should the nurse assess first? A. Patient with irregular heartbeat. B. Patient with mild fever. C. Patient requesting food. D. Patient with headache. Correct answer: A. Patient with irregular heartbeat. Rationale: irregular heartbeat may cause cardiac arrest. Strategy: cardiac problems first. Question 27. Which patient should the nurse see first? A. Patient with severe allergic reaction. B. Patient with rash. C. Patient requesting water. D. Patient with nausea. Correct answer: A. Severe allergic reaction. Rationale: risk of anaphylaxis and airway closure. Strategy: airway emergency. Question 28. Which patient should be assessed first? A. Decreased urine output. B. Mild headache. C. Patient requesting food. D. Patient with nausea. Correct answer: A. Decreased urine output. Rationale: indicates possible kidney failure. Strategy: organ failure equals priority. Question 29. Which patient should the nurse see first? A. Fever 39.5 degrees Celsius. B. Mild fever 37.5 degrees Celsius. C. Patient requesting medication. D. Patient with constipation. Correct answer: A. Fever 39.5 degrees Celsius. Rationale: high fever indicates infection/sepsis risk. Strategy: severe vital sign change first. Question 30. Which patient should be assessed first? A. Patient with new weakness. B. Patient with mild fatigue. C. Patient requesting water. D. Patient sleeping. Correct answer: A. Patient with new weakness. Rationale: sudden weakness may indicate stroke. Strategy: acute change first. Question 31. Which patient should the nurse see first? A. Patient with oxygen saturation 85%. B. Patient with mild headache. C. Patient requesting pain medication. D. Patient with constipation. Correct answer: A. Patient with oxygen saturation 85%. Rationale: low oxygen saturation indicates hypoxia and respiratory compromise. Strategy: airway and breathing first, ABC rule. Question 32. Which patient should the nurse assess first? A. Patient with blood glucose 45 mg per deciliter. B. Patient with blood glucose 210 mg per deciliter. C. Patient with blood glucose 180 mg per deciliter. D. Patient with blood glucose 160 mg per deciliter. Correct answer: A. Patient with blood glucose 45 mg per deciliter. Rationale: hypoglycemia is life-threatening and can lead to unconsciousness. Strategy: low glucose kills fast. Question 33. Which patient should the nurse see first? A. Patient with sudden inability to speak. B. Patient with mild sore throat. C. Patient requesting food. D. A patient with mild nausea. Correct answer: A. Patient with sudden inability to speak. Rationale: sudden inability to speak indicates possible stroke. Strategy: acute neurological change equals priority. Question 34. Which patient should the nurse see first? A. Patient with respiratory rate 32 per minute. B. Patient with respiratory rate 20 per minute. C. Patient with respiratory rate 18 per minute. D. Patient with respiratory rate 16 per minute. Correct answer: A. Patient with respiratory rate 32 per minute. Rationale: rapid breathing may indicate respiratory distress. Strategy: breathing problems first. Question 35. Which patient should be seen first? A. Patient with active bleeding from wound. B. Patient with mild pain. C. Patient requesting water. D. Patient with constipation. Correct answer: A. Patient with active bleeding. Rationale: active bleeding may lead to shock. Strategy: circulation problems first. Question 36. Which patient should the nurse assess first? A. Patient with difficulty breathing after medication. B. Patient with mild rash. C. Patient requesting discharge. D. Patient with nausea. Correct answer: A. Difficulty breathing after medication. Rationale: possible allergic reaction/anaphylaxis. Strategy: airway emergency first. Question 37. Which patient should be seen first? A. Patient with new onset confusion. B. Patient with mild fatigue. C. Patient requesting blanket. D. Patient with constipation. Correct answer: A. New onset confusion. Rationale: sudden confusion may indicate hypoxia or stroke. Strategy: acute mental change equals priority. Question 38. Which patient should the nurse see first? A. Patient with potassium 6.2 milliequivalents/L. B. A patient with potassium 3.5 milliequivalents/L. C. A patient with sodium 138 milliequivalents/L. D. A patient with calcium 9 mg per deciliter. Correct answer: A. Potassium 6.2 milliequivalents/L. Rationale: high potassium can cause cardiac arrest. Strategy: dangerous lab values first. Question 39. Which patient should the nurse assess first? A. Patient with sudden severe headache. B. Patient with mild headache. C. Patient requesting food. D. Patient with constipation. Correct answer: A. Sudden severe headache. Rationale: may indicate brain hemorrhage. Strategy: sudden severe symptoms equals priority. Question 40. Which patient should the nurse see first? A. Patient with temperature 35 degrees Celsius. B. Patient with temperature 37 degrees Celsius. C. Patient with temperature 36.5 degrees Celsius. D. Patient requesting water. Correct answer: A. Temperature 35 degrees Celsius. Rationale: hypothermia can lead to complications. Strategy: abnormal vital signs first. Question 41. Which patient should the nurse assess first? A. Patient with stridor after surgery. B. Patient with mild sore throat. C. Patient requesting pain medication. D. Patient with constipation. Correct answer: A. Stridor after surgery. Rationale: indicates airway obstruction. Strategy: airway emergency first. Question 42. Which patient should the nurse see first? A patient with chest pain and shortness of breath. B. Patient with mild cough. C. Patient requesting discharge. D. Patient with nausea. Correct answer: a chest pain and shortness of breath. Rationale: possible myocardial infarction. Strategy: cardiac symptoms first. Question 43. Which patient should the nurse see first? A. Patient with sudden swelling of lips. B. Patient with mild rash. C. Patient requesting water. D. Patient with constipation. Correct answer: a sudden swelling of lips. Rationale: indicates possible anaphylaxis. Strategy: airway emergency first. Question 44. Which patient should be assessed first? A. Patient with no urine for 12 hours. B. Patient with mild nausea. C. Patient requesting blanket. D. Patient with headache. Correct answer: no urine for 12 hours. Rationale: indicates possible kidney failure. Strategy: organ failure priority. Question 45. Which patient should the nurse see first? A. Patient with unequal pupils. B. Patient with mild headache. C. Patient requesting food. D. Patient with constipation. Correct answer: A. Unequal pupils. Rationale: may indicate brain injury. Strategy: neurological emergency first. Question 46. Which patient should be seen first? A. Patient with sudden difficulty breathing. B. Patient with mild cough. C. Patient requesting medication. D. Patient sleeping. Correct answer: A. Sudden difficulty breathing. Rationale: respiratory distress is life-threatening. Strategy: breathing first. Question 47. Which patient should the nurse assess first? A. Patient with heart rate 40 bpm. B. Patient with heart rate 88 bpm. C. Patient with heart rate 92 bpm. D. Patient with heart rate 76 bp. Correct answer: A. Heart rate 40 bpm. Rationale: bradycardia can decrease cardiac output. Strategy: abnormal vital signs first. Question 48. Which patient should the nurse see first? A. Patient with sudden chest tightness. B. Patient with mild anxiety. C. Patient requesting water. D. Patient with constipation. Correct answer: A. Sudden chest tightness. Rationale: possible cardiac emergency. Strategy: cardiac symptoms first. Question 49. Which patient should the nurse assess first? A. Patient with oxygen mask removed and restless. B. Patient sleeping. C. Patient requesting discharge. D. Patient with mild pain. Correct answer: A. Oxygen mask removed and restless. Rationale: restlessness indicates hypoxia. Strategy: early hypoxia signs first. Question 50. Which patient should the nurse see first? A. Patient with sudden drop in blood pressure. B. Patient with mild headache. C. Patient requesting food. D. Patient with constipation. Correct answer: A. Sudden drop in blood pressure. Rationale: sudden hypotension indicates shock. Strategy: circulation emergency first.